Welcome back. That was a fabulous, fabulous session to get us started. And here we thought we were going to have to find ways to get you further engaged in the conversation. But the next part of our program really is designed to dig deeper with some of the questions and issues that were raised with the last presentation. So the first part of this, I'm going to ask tables 1, 2, 3, and 4 to look at question 1, and 5, 6, and 7 to look at question 2. Those of you who are not at tables or in the side of the room and other overflow rooms, figure out which of those you might want to grab somebody next. It's going to be loud in here anyway, but grab a small group of people around to start talking about this. The first 2 questions, we're actually going to look at 2 sides of what we heard about this morning, summative and formative assessment. So really thinking about the difference between assessment of learning and assessment for learning, and the value of both, the intersections of both. I want to remind you all that we've got students and patient, quote-unquote, patient representatives at our tables. We've also intentionally made sure that the tables are not homogeneous in terms of discipline and profession. We have interprofessional tables. So these conversations really do need to begin with that in mind. If we're going to be moving interprofessional education forward, we also really need to be thinking about the assessments that we could be using to look at that and to guide that, to help us move this forward. We're going to be, so the question 1 is from the perspective of assessment of learning. What makes a good assessment tool or measure? And think of examples if you can. And group 2, those of you who are looking at question 2, you're going to be looking at assessment of or for learning. And so John actually introduced something that I hadn't thought about. It's not just the formative, but the creation of learning that can occur with assessment as well. And so that's become a bit more layered. So we're going to give you 10 minutes to talk at your tables, and then I'm going to pull folks back so that we can hear from you. And it'll be interesting to hear what overlap there is in the assessment of and assessment for learning. So we've got facilitators at the table ready to help guide the process. You're on.